start so that we can get started tonight. We have Paige Kalika joining us tonight. Dr. Kalika is an assistant professor of clinical neurology and pediatrics. She was born in Brooklyn, New York. So are you a Yankees fan? I didn't ask you before.
I suppose I'm not much of a baseball fan. Don't hate me.
Okay. No, that's fine.
If I have to be a fan, I'm a Mets fan.
Okay, great. I think I like you already that you're not a Yankees fan. No, I'm teasing. I don't know who our other New York guests might say something different, but she is from Brooklyn, New York, and she graduated from Cornell University in 2000. She earned her osteopathic medical degree at the University of Medicine and Dentistry of New Jersey, the School of Osteopathic Medicine. In 2004, she completed her residency in pediatrics at Jersey Shore University Medical Center in 2007, and her fellowship in child neurology at SUNY Downstate in Brooklyn in 2010. She is also board certified in neurology with special qualification in child neurology. So right on brand of what we're talking about tonight. And she's also certified in headache medicine. So I'm really excited to learn more about that tonight. She joined the University of Miami Department of Neurology in 2011, and she practices general child neurology, but she also has a particular interest in pediatric headache and migraine. So, right, exactly what we're talking about tonight. She's the director of the Pediatric Headache Clinic at UHealth and at Jackson Memorial. I didn't even know that there was a pediatric headache clinic, so you'll have to tell us more about that. And her research includes treatment and prevention of acute migraine in pediatric populations. She also has an interest in pediatric neurogenetics, and she sees patients in tandem with genetics at UHealth at Weston. So Dr. Kalika, welcome. We're so excited to have you tonight.
Thank you. I'm so happy to be here.
I mean, if anyone is an expert in this, it sounds like it's you.
Well, I do it a lot, and I love working with these kids and trying to reassure their families that there's nothing horrible going on, but
I love it.
The kids are having trouble, so let's help them.
That's great. I wonder if we could start. I'd love to know how you got into this field. I always feel like, we have kind of a lean and a design towards what we want to learn, but there's usually like a heart and a passion too behind what we're doing. And so what specifically led you to the neurology and the pediatric emphasis?
Well, in med school, we figure out pretty quickly if we're pediatric people or not pediatric people. In general, the pediatric population, in terms of doctors, gets divided up into the ones who love kids and the ones who hate adults.
Oh, no.
I hate adults. No, I like adults just fine as long as they're not my patients. But I really like working with kids and being with kids all day. They are so much fun. You learn so much from them. I get to ask what their favorite superhero is and what their favorite dinosaur is, usually T-Rex and Spider-Man. Those are the two favorites.
For sure.
And I thought pediatrics was just the best thing. And when I started pediatrics, I realized that my favorite part was learning about how kids grow and think and how their brains work, and that's neurology. And I think I'm so lucky because I get to do this every day.
That's awesome. That's awesome. Well, we are excited to learn from you tonight. I know we've got a lot of questions already set up ready for you, but those of you who are listening in, if you have a specific question at any time, please drop that in that Q&A feature and I will get that in front of Dr. Kalika. So let's get started with, again, I have to say, I was baffled. I thought, can children even get headaches? But obviously, of course they can. So are headaches in children dangerous?
Usually, no. Almost every single headache that a kid is going to have is almost always going to be benign. Now, if your kid starts having a lot of headaches, severe headaches, headaches where they're not acting right, they seem weak or confused or something really seems wrong, of course, always follow your instincts. If your kid doesn't look good, get them checked out immediately. If it's something not too bad, your pediatrician is the best. But if something big, bad, and scary is happening, you go right to the emergency room. However, in terms of headaches, most headaches are very, very, very benign. They're not dangerous. Most of the time, there's nothing to worry about. We just want to go over a few things to say, okay, these are the big, bad, scary things that we need to watch for. Everything else, deep breath, everything's fine. Just let's treat the headache and get the poor kid feeling better.
That's good. So what actually causes headaches?
Well, I like to say some people are just lucky in that they're headache people. And if you're a headache person, you're a headache person. For my kids with migraines, I say, oh, good news, you're smart and sensitive. Those are the people who get migraines. And they all look at me like, yeah, but I'm sorry, the bad news is you also get migraines. So
yeah.
in headaches, they often run in families. So families that have migraines tend to have kids that have migraines. Same thing with tension headaches, although those are usually not quite as severe. But actually, the most common reason a kid has a headache is they're sick. They have a virus. Flu is notorious for headaches. COVID is notorious for headaches. You can get them with allergies and other things. So if your kid has never had a headache before and they're acting kind of sick and pokey and they're complaining of headaches, it probably has to do with what's going on. So it's related to however they're feeling that day.
Okay.
But other times we get kids who, they just start to get headaches more consistently and they're not sick and there's nothing wrong with them. And those are the headaches that tend to often run in families.
Okay. Interesting. So you're saying that kids can get migraines and tension, sort of kind of like the same ones that adults get, essentially.
Very similar in some respects. Now they can actually present differently in kids. There's actually a whole bunch of we call migraine phenomena or migraine variants, or we have a lot of names for these kind of very interesting, as long as your kid isn't suffering it, conditions, which we realize are how kids can experience migraines. And it can be a kid who seems super duper dizzy, or a kid who's just having these weird belly aches, or a kid who's having vomiting. And these can all be phenomena related to migraine.
Interesting.
But most of the time, those kids don't end up with me right away. You end up seeing the gastroenterologist and the ENT and all kinds of doctors before someone says, hey, wait, and then you come to me. Most of the time when I'm seeing kids, it's because they're complaining of headaches, and they can be very similar to adult headaches. They really can.
Okay. So what should we do if our child has a headache? How do we know? Just it'll wear off. Don't worry. Or like, oh, maybe we should take something. Maybe we should go somewhere.
The most important thing when someone's having a bad headache is believe them. Most of the time, kids are not trying to get out of homework or trying to avoid things. Usually, they look kind of miserable. If your kid doesn't want to play, they don't want screen time, they just want to sit or go lie down in a dark, quiet room, that's your hint. That's a headache. We believe that one. And if they're having a headache, they know exactly what they need. They need a dark, quiet room. Let them go to sleep. Maybe give them something cold to drink if they're not feeling too nauseous. A cold cloth on their forehead. All these things are good. Let them rest. And I tell everyone, don't be afraid to give them a little bit of medicine if they need it.
Okay.
Because you're not masking anything. A lot of times we're like, oh, I didn't want to hide the headache. I'm like, hide the headache. They don't want the headache.
Right. Well, that was my next question. I'm like, at what point do you, I'm thinking about myself too. I'm like, should I go straight to the Tylenol or should I just try laying down first? But for our children, yeah. So medicine, you say, don't be afraid to.
Don't be afraid to use it. Now, a lot of times it's not a big headache. Like if your child is perfectly happy to watch TV and play video games, they usually don't need medicine for that one. Let them rest, let them chill. And if it's again a headache where they can lie down and go to sleep right away, sleep is the best cure. But if they're miserable, don't be afraid to give them medicine. It's okay. Follow the directions on the bottle for how much to give them. If they're kids, but adult-sized kids, they can have an adult-sized dose. That's if they're over 100 pounds. If they're smaller than that, follow the dosing instructions or check with your pediatrician. Everyone tends to underdose, which is why whenever people tell me, oh, we tried the Tylenol and the Motrin and it doesn't work. How much did you give them?
Yeah.
As parents, we just want to take the edge off. We don't want to give too much medicine. Don't do that. The medicine doesn't work that way. Either give the medicine or don't give the medicine. Don't do half doses because then it might not help. And if there are any reactions or side effects or things you're worried about, well, they can happen anyway. They took the medicine. So if you're going to do
then you got a headache and a side effect.
Exactly. And the side effects are really pretty rare. I would worry much more about the headache than the medicine. As long as we're using it appropriately, we're not using it too much. Again, always check with your pediatrician if you're having questions or concerns. Am I using the medicine too much, not the right way? Check with them. And if there's issues, then you come and you visit me.
Okay. That would be my next question is say frequent. Like if your kid is having frequent, will you define also like what is frequent? Like once a week or once a month or
frequent means different things to different people. I have some families who say, oh, yes, he has headaches all the time. Oh, how often? Every other month. I'm like, I don't want to minimize having a bad headache every other month because nobody wants to have a headache.
yeah, you don't want one at all.
It's like, okay, when we start to get into the once a week, twice a week, 3 times a week and more, that's a lot of headaches. And we have to say, all right, let's check that out. Again, usually it's nothing sinister or dangerous that's going on, but that's a lot of headaches to have. That's a lot of time out of their lives when they should be having fun and playing and not lying in bed with a headache.
Mm-hmm, mm-hmm. So if, say, a child is having frequent headaches, say a few times a week, is there something different that we, like, okay, we're going to rest, we're going to medicate, but also at that point, start with your pediatrician? And would your pediatrician recommend a neurologist?
A lot of times the pediatricians will manage on their own at first because we actually have studies that show that most kids with headaches never actually make it to neurology because their pediatricians can handle it, because a lot of it is common sense. Although when your kid's the one who's crying and miserable, it's really hard to have common sense.
Yeah.
But that's why even doctors take their kids to other doctors, because we can't think straight when it's our kid.
Right.
So the pediatrician will probably say, all right, make sure they're drinking enough water, they're not skipping meals, they're getting enough sleep. This is a big one. I say this all day, every day. Eat well, sleep well, drink lots of water. Daily exercise is important. Screen time. A lot of times we'll notice that the headaches are linked to the screen time, or maybe they're not directly linked to the screen time, but we're doing a lot of screen time before bed because, come on, everyone wants to chill out with their iPad before bed, or we're watching movies, we're playing video games. And the problem is that the light from the screens tricks our brain. It messes with our circadian rhythm. That's our body's alarm clock. It tells us when to wake up and when to go to sleep. And what happens is it's nighttime, that the sun is down, it's dark outside, but the light from their screen tricks our brain. We think that, oh no, the sun is up again, so it keeps us up. Our brain doesn't want to start settling down into sleep mode. We're all active, and it's really hard to break that cycle. So I tell everyone, I'm the mean person. It's not mom's fault. It's not dad's fault. I'm saying no screen time an hour or two before bedtime. Don't yell at mom and dad. It's me.
Yeah.
A lot of times the pediatrician will
for parents too.
Oh, I know. I can be the bad guy. It's hard for me to be the bad guy to my kids, but other people's kids, that's my job. That's what I'm doing. So a pediatrician will do a lot of that kind of supportive care, saying, all right, let's try these things. They also may say, let's keep track. One of the most important things that the pediatrician, or if not the pediatrician, that I will tell you to do is let's keep track of the headaches, because what's causing them? Sometimes, it doesn't look like there's any triggers, but if we start to, write it down, keep a journal, we may notice, hey, she gets a headache every Friday evening. Friday is pizza day. Oh, I hope it's not the pizza. But we don't know unless we keep track, and it's hard. Because I'll always ask, how often are you having headaches? How frequent are they? But if I ask you, so back in November, how many headaches a week was it? Who remembers that?
Yeah, that's right.
This way we can keep track, and going forward, we'll know how they're doing, because we can say, hey, look, in January, she was having 3 headaches a week. Now it's March, we're down to 1 headache a week. That's fantastic. We cut the headaches by 2/3. That's a big deal, actually.
That's great. Oh, that's good advice to track, because sometimes you think, what could it be? But maybe you don't see those patterns until you really take that time to write it down and track it. That's great. I'm going to share with you a few questions from our audience. So one is, are MRIs and EEGs necessary for complex migraines?
All right. The short answer is, it depends. The long answer, as always, is long. So in general, we don't need to do MRIs for classic migraines. So if someone comes to me and I say, wow, this is the classic migraine story, there's no red flags, I'm not worried at all here, we don't need an MRI for that. Especially because MRI, there's no radiation. CAT scans have radiation. MRIs, all cool magnet stuff, no radiation, but you have to lie still for 30 to 60 minutes. And if you're
ever tried to get a kid to do that?
You know what? Once in a while, I'll get a kid who can.
Amazing.
But, a lot of times for the little kids, they can't do that. So you have to sedate them. And I don't want to do that if I don't need to. So if I don't need an MRI, I'm not going to order one. Now, if there's something weird going on, if you're having symptoms that aren't, classic migraine, they make me think there might be something else going on. If we're talking about a really little kid, and for me, really little means under 6 or so,
Yeah.
I realize that, like under
It's relative.
15,
Yeah.
really little for headaches for other people. Now, for me, it's under
Under
6.
6. Okay.
If we have a change in the headache frequency where you say he never had a headache in his life, and then all of a sudden we went from 0 to 60, he's having headaches every day. They're waking him up from sleep. He's throwing up with them in the middle of the night. I'm like, okay, that makes me a little nervous. Let's go ahead and check that MRI now.
Yeah.
Now, EEG is a different story. EEG is a test that we do to look for seizure activity. It tells me someone's at high risk for seizure. It
Right.
does not tell me much about migraines at all. So it's not a test that I would do routinely. That said, once in a while, we can have some funny stuff associated with migraines. So then I might say, okay, let me do that EEG just to make sure we're not having funny seizures here. But that's very, very rare. It's usually not a test that's useful or indicated for just plain old migraines. There has to be something else going on that makes me suspicious.
Yeah. Okay. Thank you. A clarifying question too on just migraines. Can you speak in general of the difference in like, I have a headache versus I have a migraine? Like, how would you classify those differently?
That's a great question, and something I always like to go through with my families, because we think of a migraine as just being a bad headache, but that's not quite the same. Migraines are often bad headaches, but they are not only bad headaches.
Okay.
Very specifically, a migraine is that really horrible headache where your head is pounding, the light bothers you, the noise bothers you, and you want to go lie down. Often you can be dizzy with it. You can have nausea with it. You may even throw up with it. Some people have double vision, blurry vision, zigzags, squiggles, black spots in their vision. You can have all kinds of weird stuff associated with it, but you don't have to. But the classic feature, pounding headache where the light bothers you and you want to go lie down. You can have other headaches that are bad, but if they don't have those classic features where, you need to turn off the light and lie down, it's not a migraine.
Okay. So
Other
it's not like
headaches
a
are
certain part of your head. I kind of always thought, oh, if it's here, it's a migraine, or if it's here, or if it's here.
Well, actually, that's an interesting point. So when we're talking about the difference between adult migraine and pediatric migraine,
Okay. It's different.
adults tend to have headaches one side of their head, pounding, pounding, pounding. It can be behind the eye. People say it's in my eye, or it's on the side of their head in the temple, and it can switch sides also. So for adults, it's almost always just on one side.
Interesting.
For kids, you can have it on both sides. It's very common to have it both sides here, the temple. Some people can have it in the back of the head. You can have it all over. So it's not the location that makes the migraine.
Interesting. Okay. Wow. Great. I learned something new. I'm learning lots of new things, but that was, yeah, very great. Okay. A couple other questions from our audience. This listener says her daughter can be physically sick when she has a headache or migraine, that she's given her medicine for her headache and minutes later she vomits. In those cases, what should she do about more medicine? She said, I don't want to give her too much, but I'm afraid there wasn't enough time for the medicine to get in the system.
Well, let me reassure you, if she took the medicine, even if it was, like 10 minutes ago, it probably got into her system.
Okay.
Especially the liquid medicines, those are absorbed really fast.
Okay.
So I would, unless you literally put it in and then it comes immediately out, I would not redose the medicine.
Okay.
And the next thing is, sounds like somebody needs something for the nausea. So this is, again, super common with migraine. And a lot of time, this is the most bothersome symptom. This is the thing that makes them the most miserable, how nauseous they are. So when I have one of my kids who's super duper nauseated, I'll say, okay, how about we get you medicine for the nausea? So you can give that. That's okay to give.
Okay. That's great. Another question from our audience, and I understand this is not like an office visit, so I don't know how specific you can be. Again, we always encourage you to see your doctor or call Dr. Kalika and visit her. But so this listener says that her son complains of headaches all the time, that he had a CAT scan a few years ago because of the headaches, but it was normal and the headaches continue often when they're in the car. And she's kind of wondering, should I do an MRI? I give him medicine once a day, but I'm concerned of the side effects.
Okay, so the short version is I'm not surprised that the CAT scan was normal, because pretty much all the time when you have a kid who's otherwise fine and they have a normal neurological exam, it's going to be fine. You're not going to find anything in the CAT scan that's going to be causing the headache. You can't see migraines on there. And again, I am not giving specific medical advice because I haven't taken my history, I haven't done a physical.
Right.
But in general, we often don't need to do an MRI because, and this is something which is very comforting to neurologists and not at all comforting to parents. If he's been having this for years and it's not been changing and he's still miserable with it, but he's still okay, it's nothing bad. Because if it were something bad, we would have known a long time ago.
Mm.
For some reason, parents don't like to hear that. They're like, what do you mean? I'm like, well, if there was something horrible, we would know by now. So no, if this has been going on for a long time, that doesn't mean it's nothing, because it's something. He's miserable.
Yeah,
But
poor guy.
I don't think it's something we're going to see on an MRI.
Yeah.
So I don't want him to have medicine every day for the headaches, because that's not good for you. But at the same time, we don't want him to suffer. This is someone who needs to go visit first the pediatrician to see what she can do. And if the pediatrician is concerned, this is someone who's a good candidate to come and visit me, and we can talk about our options. And instantly, I know that you mentioned the motion sickness. This is super duper common. There's a big link between migraine and motion sickness. So again, those smart, sensitive kids with their motion sickness, they're our migraine kids. So I'm sorry, it's not fun, but you can also talk to the pediatrician if there's anything that they can give for motion sickness. That's a better question for the pediatrician than for me, though.
Yeah. Okay, great. Another one, and this might be specific, so I'll just let you handle this. But our grandson, who just turned 17, has had a continuous headache for almost 3 years. Oh, sounds awful. He has seen every specialist imaginable: pediatrician, neuro-ophthalmologist, pediatric neurologist, etc. He's undergone almost 3 years of testing, MRIs, labs, exotic brain scans, even with intensive research, including tracking the electrical waves of the brain, and multiple trips to the ER, being hospitalized. Oh, poor buddy. I'm so sorry I fell for your grandson. But he said the doctors cannot come up with a diagnosis. Do you have any suggestions? It sounds like he's had hopefully some great care.
It sounds like he's been extensively tested, and it sounds like nothing's been found, which again, this is one of those things which is reassuring to me and not so much to anyone else. If we haven't found anything horrible in the brain, that's good.
That's good. Yeah.
It's frustrating because, like, well, if we can't find it, how can we treat it? I'm like, no. You don't want to find anything bad in someone's brain.
Right. That's right.
Those are not fun things to treat.
Yeah.
And that one usually isn't a me problem. That's a question for our lovely neurosurgeons. And
Right.
they're wonderful people when you meet them, out in real life, but you don't want to visit them professionally.
Yeah.
So I don't know if this is what he's going through, because again, I don't have a full history.
Right. A relationship.
But sometimes if there's an entity called new persistent daily headache, which is where you wake up or develop a headache one day and then you just have a headache every day. And it's really annoying and we can't find anything wrong with you. You just have a headache. And these can be really miserable to try to treat. We just try a lot of different things and see if something sticks. So it sounds like that's what you've been doing. And I don't know if he's tried this, but he's 17. He's getting close to being 18, which is the magic age when all of a sudden we can use some of the treatments that are approved for adults. So that would be something to look into if they haven't been done yet, but just deep breath. And I would also recommend that if he hasn't seen someone already, he also works with a psychologist and who can do cognitive behavior therapy.
Okay.
When people ask me, well, what can we do to treat headaches? We say, oh, well, there's medicine and this and that, but I always talk about evidence-based medicine, because I figure that if you're coming to see me, you don't need my opinion. You need me to tell you what our evidence shows, what people have been studying and researching, and what's likely to happen, what's not likely to happen. And something that we've seen that can be very effective is cognitive behavior therapy for pediatric and adolescent migraines, because a lot of times headaches are caused by or worsened by stress. I say stress causes migraines, migraines cause stress. We go round and round in a circle.
Yeah.
And I say, okay, well, we got to slow the roll here. We got to figure out how can we treat the headaches, but also work on the stress. So the CBT can work on that. I don't know that that's going to be enough to go from a 10 out of 10 headache to a 0 out of 10 headache.
Right.
But this can give him techniques.
Yeah.
Exactly, because this is someone who we want to be able to let him go out and live his life.
Yeah.
And I tell everyone, if you're dealing with constant chronic pain, everyday pain, even if you didn't start out with anxiety and depression, you're going to be struggling with it, because this is a kid who wants to live his life.
Yeah.
So a lot of times working with a therapist, someone who understands pediatric pain, may be able to help him not necessarily take the pain away, although that would be lovely, but to help him work through it and live his best life while we're waiting for something to help with the headache.
Yeah. Interesting. Yeah. So they added that the electrical waves of the brain of his brain are similar to someone with PTSD. So that might be could be very helpful.
It might be.
Yeah. Great suggestion there. All right. Someone asked too, are headaches could they be part of growing pains? You know, when I was growing up, it'd be like, my legs hurt so bad. And my dad would say, you're just getting taller. And I'm like, really? Am I really? But could headaches be, oh, you're growing?
I don't know that they're growing pains so much, but we can see headaches as part of, I hate to say the growing process, but as you get older and you start going through puberty, a lot of times that's when we start to see headaches, especially in girls.
Interesting.
In adults, headaches have a reputation of being a female problem. There are plenty of men who have headaches also, but what we see are that women tend to have more headaches, worse headaches proportionately. Now, when we look at little kids who haven't yet gone through puberty, it's actually equal, boys and girls.
Oh, wow. Interesting.
Once we hit puberty, though, all of a sudden those girls start taking off. So I don't think it's necessarily like a growing pain thing or part of growing up, but some people, as they get older, their body and their brain says, okay, it's time. Who's ready for a headache? Nobody's ready for a headache, but sometimes that's just what we get.
Oh, that's right. Well, let's talk a little bit about triggers that could cause migraines, because I have friends, who, when they're young, they knew certain things, like I have to stay away from this because it will trigger a migraine. But are there certain foods? Can you tell us more about triggers?
All right. So triggers are really important to talk about because it's different for everyone. There are common triggers like being hungry, being thirsty. This is a big one. Not sleeping. That's a huge one. Stress. And I say school, family, school, family, friends, school, more school. You'll notice that headaches tend to be better over vacations, not because the kids are trying to get out of school. Usually these are high achieving kids. They don't want to go to school. They're just miserable because they got these bad headaches. So
that's easy to probably misinterpret too, because you think, well, you're fine on vacation. But it's
funny.
Like
you haven't complained of a headache all week.
Interesting.
But now is the minute you go back to school. Yeah. No, that's the thing is over break. Usually the stress is down. They're sleeping. They're not skipping meals. They're doing tons better. Then they go back to school and everything starts again. Yeah. And we have other triggers. Smells are a big trigger. They will know. They'll tell you cigarette smoke gives me a headache. Perfume gives me a headache. So those. And foods. And this is different for everyone. There are some foods which are kind of common triggers like cheese, tomatoes, pizza. Red wine, which hopefully not so much in the kids. Citrus fruit for some people. Caffeine for some people. And then there are individual ones. I had one kid tell me salmon. I had two kids tell me barbecue pork.
Interesting.
So the only way we know is we keep track. Now, a big one that everyone asks me about is chocolate, because we all love our chocolate. Well, all right, most of us love our chocolate. I know there are a few people out there. That's okay. I will eat your chocolate for you.
There you go.
And by the way, nobody has to believe me on this one because no one ever does. However, we've actually done some studies to look at it, and we have found that chocolate doesn't trigger migraines. However, before we have a migraine, there is something called a premonitory phase, which is something that can start, a day or two even before the headache. And you just start to have these kind of mild symptoms that a lot of times people don't even realize are linked to the headache. You're yawning more, you're more thirsty, you're feeling down, you develop food cravings. What do we crave? We crave chocolate. So chocolate doesn't cause migraines. Migraines cause chocolate.
But you need that on a plaque or something in your office.
But it's hard. It's hard because if you have that association between the chocolate and the migraine in your head, it's really hard to talk yourself out of it.
Yeah. Well, with Valentine's coming, everyone can rest easy then.
So.
No, this is great. This is really helpful information. We're getting lots of questions from the audience too, so I want to get to those. Okay, here's one. Someone asked, can you talk a little bit about hemiplegic migraines and what medications are used? And can you define what that means for those who don't have any idea?
So hemiplegic migraines are migraines that go along with your headache. You get weakness on one side of your body. So hemi, is one side, plegic, weakness. So migraine with weakness of one side of the body.
Interesting.
So what happens is you look like you've had a stroke. And it's very, very scary. But the good news is Hemiplegic migraines or complicated migraines, which is just any migraine that has some funny symptoms like that, are usually more common in kids than strokes. So I'm not saying don't rush your kid to the emergency room. Please rush your kid to the emergency room. But chances are better than not that, once they get through their headache, that they will feel better.
Wow.
So this is, it's a relatively rare headache type, but there are absolutely people who have it. I think someone was in the news lately with it. I just read about that today.
Okay.
I'm not sure if that's what brought the question or not. But so it's a normal goes in quotes, migraine, just associated with this extra these extra symptoms. And once you get your workup, because I'm sorry, if you bring your kid into the emergency room with a headache and, not moving half their body, they're gonna get a big workup just to make sure.
Yeah.
And you say, well, okay, what do we do about it? And the treatment is actually fairly similar. There are some different everyday medicines that we can use to try to prevent it. And a lot of them are very effective. The interesting thing to know about it is that these often run in families. So there's a lot of study going on into the genetics of migraine, because like I said, migraines run in families, they're hereditary.
Okay.
But we haven't really associated, common run-of-the-mill headaches with a lot of different genes. But the genetics of these hemiplegic migraines are actually starting to be pretty well understood. So there are a few certain genes that are associated with it when it runs in families. And then, of course, sometimes it just kind of pops up and we call it sporadic, just comes out of nowhere. And congratulations, you have hemiplegic migraines. And most of the time, people do very well with them. If you have frequent headaches, just like any other headache type, we say, all right, let's try to prevent them. If they're less frequent, we talk about, all right, well, it's really scary and dramatic when it happens. Is it worth taking an everyday medicine to try to prevent it? Or do we just want to, keep a medicine on hand to try to take care of the headache when it happens? And that's individual. That's a big discussion that we have, with the kid and the parents.
Yeah, great. Well, I feel like you answered two questions in one, because another question was, are migraines hereditary? Which you said, yes, they are. And, she said her son is now showing signs since he hit puberty. He doesn't describe the pain as migraine, but they're just headaches at this point. So sounds like he's one of the lucky ones.
Lucky. Tell him he's smart and sensitive.
Smart and sensitive. Way to go. Yeah, it's just a bummer to have to suffer in that way. What about, someone asked, can you speak about triptans to treat pediatric migraines?
Absolutely. So we don't have a lot of medicines specifically for headache, because a lot of the medicines we use are actually from other classes, things that we use to treat other things.
Okay.
But triptans are a class of medicine that, we use. I think the only thing we use them for are headaches. So there are a whole bunch of them out there. There's sumatriptan, rizatriptan, lots of them. And what they do is they treat a migraine that's happening. We used to say, wait to see if it's going to be a bad headache and then take your medicine. No. These days we're saying, don't wait, because we know the faster we get to that headache, the easier it is to treat. So this is a medicine that you feel the headache coming on, or if you have an aura is sometimes we can describe it as like the beginning part of the headache that isn't the headache yet. So we kind of conflate migraine and headache, but migraine is more than just a headache. It's a whole constellation of other things that go along with it. It can, because the migraine is the nausea, the migraine is the vertigo, the migraine is the double vision, or the visual auras where you have like black spots in your vision or squiggles in your vision. You can have all kinds of fun stuff. The neurology is fascinating. The actual, living with it, not so much.
Yeah.
So if you feel that headache coming on, or you get your aura saying, uh-oh, headache's on the way, you can go ahead and take your triptan, which is a good medicine to try to get rid of that headache before it really digs in its heels and gets started.
Okay, great. No,
thank you. I should mention that out of all the, there are a bunch of different triptans. 4 of them are approved for kids. This is important because if they're not FDA approved for kids, our insurance company will not pay for them.
Okay.
So rizatriptan is approved 6 and up. Sumatriptan, elatriptan, and nartriptan, I think, unless it's amitriptan, are approved 12 and up. And another nice thing about the triptans, they come in some different forms. So there's, the tablet that you can swallow, but there's also a nasal spray and an injection. So If you're feeling so nauseated, you can't take something by mouth, there are
Your
options.
options. Okay. And those are all prescription based, correct?
Those are all prescription.
Yeah. Okay. What about, let's see, here's another question from our audience. Any migraine medications that older kids, like 15, 16, specifically for that age that you suggest?
Nothing specifically for that age. It's not so much that we have things that are specifically for that age. It's that our cutoff for things that are approved for adults, that's 18 and up, and anything under 18, it's harder to get it. In fact, we don't even have that many migraine medications approved for kids at all. So we have the 4 triptans that are approved, and we have one medicine, Topamax, which is actually a seizure medicine, which happens to work sometimes for headaches also. That's approved 12 and up for pediatric migraine. However, in the world of pediatrics, a lot of what we do is off-label. So there are a lot of medications that are not specifically approved for this in pediatrics that I'll use anyway. However, some of them, and this unfortunately includes the new fun medicines, I say the new fun ones because in the last few years there has been this revolution in treatment of migraine for adults. But there are some amazing medications which have been absolute game changers. And I can't use them for kids yet. We're starting to get them on appeal for kids. We're starting to be able to push it through. So sometimes we get lucky. So for 16 and 17-year-olds, we may be able to try to get them. And we're right now doing studies to get them approved for the younger age groups. I'm actually involved in 2 of them now, and I'm very excited about them because these are good medicines.
That's great. Wow. That's so cool to speak to someone who's an expert. Not, sometimes we just think, oh, our doctors just, know their little thing and prescribe, but it's like, you're doing like live research about this stuff right now, which is really exciting. So you have like just this fresh info. It's awesome. Okay, we talked a little about triggers. Let's talk more like preventative. Sometimes we have a question like that the child's doctor recommended lifestyle changes and other things to help headaches, but that's really hard. Like, why can't it just only always be medicine? Like, what are other like ways to prevent migraine in children?
I tell everyone that the annoying, boring part is the most important part because I say, look, I'm dividing this up 50-50. 50% is my job, 50% is your job. But my stuff doesn't work unless you do your job. What's your job? Eat well, sleep well, drink lots of water, daily exercise, put the screens down an hour or 2 before, all that boring, annoying stuff that nobody wants to do, but it works. It works. I'm sorry, it does work. And most people would, because nobody wants to take medicine. Everyone says, oh, I don't like pills. Well, nobody likes pills. Nobody's taking one. All right. Hopefully we're not taking pills for fun. We take them because we need them. So I'm saying, here, look, if you do this, you may not even need the medicine. But I don't want to. It's hard. I know. If it were easy, we'd be doing it, by now. You wouldn't need me to tell you this.
Yeah.
But, yeah. All those lifestyle changes. And like I mentioned before, the cognitive behavior therapy, which unfortunately, it's really hard to find a cognitive behavior therapist for pediatrics. So instead, what I tell my families is, okay, I know I said put down the phones. However, we got some good apps out there. Calm, Headspace, Insight Timer, look into meditation, mindfulness, yoga. And it's not, oh, yoga will solve your problems. No, this is all about finding things which will help you deal with stress, because we know that stress is really triggering for the headache. So if we can help with the stress, then we're going to help down the road with the headaches. And it's not going to work immediately. It's, if you think back, if you've ever gone on a diet, eat healthy one day, you exercise one day, you step on the scale the next morning, oh, that didn't do anything. This is garbage.
I'm going to have the donut now.
Yeah, exactly.
Forget it. Didn't work.
It takes time. You need to do this, day after day, week after week. And over time, you'll see changes. I don't have a lot of quick fixes. I wish I did, but yeah. So you got to do your part.
Yeah.
And I don't like that. But so what can I do in terms of, before we get to medicine, I say, okay, how about vitamins? And everyone gets happy. We like vitamins. I say, guys, you know that if a doctor says take this pill, even if it's a vitamin, it's still medicine, right? But vitamins have a healthy aura about it. It's not, it's not yucky medicine. It's natural. We all have this love of natural. I say, okay, guys, natural doesn't mean good. Poison ivy, lead, and bears are natural. It doesn't mean we want them to happen to us, as opposed to Air conditioning. Who down here would live in Florida without air conditioning? Not me.
Yeah,
I
that's
go
right.
back up north. So air conditioning, not natural. We like it. Bears, very natural. I mean, if you leave them alone, they're probably not going to bother you, but still, we don't want
Right.
to mess with bears. But okay, fine. We like vitamins. And I'm not talking about just multivitamins. There are actually some vitamins, we're back to our evidence-based medicine again. So there are two vitamins in particular that we see have, good effects in terms of preventing headaches if you take them regularly. One is vitamin B2, not B12, B2, riboflavin.
Okay.
People who take it every day tend to have fewer headaches. I like it because it's usually very gentle. It may turn your pee orange. I always warn about that. Otherwise, I get really strange phone calls.
Yeah.
You would not believe it. The other one is magnesium, technically mineral, not a vitamin, but close enough. Magnesium, it's good for sleep. It's good for muscle cramps. It's excellent for constipation. And
Okay.
it's pretty good at, preventing headaches also. And I'll usually recommend this along with all of our lifestyle changes. This is kind of my first line before we want to start talking about medicine and everyday medicine and things like that. If we're not having a ton of headaches, I'll say, and even if we are, sometimes they're like, no medicine. I'm like, all right, fine, let's start with this. And a lot of times it helps. A lot of times we see the kids doing much better. Also, migraines tend to wax and wane. So, we'll have a bad, couple weeks because it's finals and we're stressed out. And then we relax a bit. Although sometimes we can get like this post-stress headache where we're used to the stress and all of a sudden the stress level drops and we get a headache because of that. Well, it's not fair.
Yeah. That's interesting. What I need you to do is to write me a prescription for a trip to Hawaii so I can rest.
I'll go with you. I'll go with you.
Can my insurance cover that? That'd be great. No, good. No, but that's so good. It's just remembering to look for ways that we could alleviate some of the root if that is, stress induced and whatnot. That's a great. Yeah. Sometimes we can't see the forest for the trees, so that's good. Great. You have so much wisdom to share, Dr. Clea. This is a lot of fun and you're just a delight to chat with. Okay. What about, and you mentioned this, someone said that their doctor wants to give their child medicine every day to prevent headaches, Is that safe? I would assume they wouldn't prescribe it if it wasn't safe, but like you said, there's other options as well to test and start with, correct?
Usually I say, okay, if we're at the point where we're having lots of headaches, and when I say lots of headaches, I'm meaning 2, 3, 4 headaches a week, and not just one bad week. It's finals, we have a lot of headaches. No. Week after week after week. That's not good for you. It's not good for you to have so many headaches. You're going to feel lousy. You're missing out on your life. And chances are you're probably taking a lot of medicine for that already. You're taking a Tylenol, Motrin, Aleve, whatever it is you're taking. And these are medicines we don't think of as being a big deal because it's over the counter. It's safe. Just because it's over the counter doesn't mean it's super duper safe. That doesn't mean don't use them. I mean, I get a headache, I'm reaching for my ibuprofen. I love it.
Yeah.
If you're taking the medicine, 2, 3, 4 times a week after week after week, one, it may stop working as well.
Yeah.
And 2, you can develop something called medication overuse headache or rebound headache, which are really nasty headaches where your body gets used to medicine and says, hey, I want my medicine. And you're saying, hey, I'm having a great day. No headache yet. Yay. Your body says, hey, where's my Motrin? And gives you a headache until you take your Motrin. That's mean. It's mean of your body, but what are you going to do? So I tell everyone, I don't want you to get to that point. Now we've got, 2 headache puzzles to unravel, and you're not going to like me when I, tell you to stop using your Motrin. So if you notice that we're getting to the point where we're having a lot of headaches, where they're disrupting, life regularly, then nobody likes medicine. But sometimes you say, well, the medicine is better than the headache, right? And if we can say yes, then okay. Now, does medicine have side effects? Everyone said, can you give me something with no side effects? Look, that's not how medicine works. If you have a medicine that can cause an effect, it's going to have a side effect. Why? Because there's nothing that, even water, affects your body. So vitamins, they're healthy. That doesn't mean they don't affect your body. Everything affects your body. So when we're at the point where I say, okay, this is someone who can really use in everyday medicine to try to prevent those headaches, say, okay, look, these are the side effects of the medicine, and we'll go through it. And just because the medicine has these side effects doesn't mean you're going to get all of them. A lot of people take it and they feel great. Other times, they say, oh yeah, at first I was kind of dizzy and, sleepy, but I'm better now. And other times we say, oh, I've been taking this medicine for, a couple of weeks and I still feel lousy. Like,
Yeah.
okay, you gave it a good try. Let's try something else.
Yeah.
So
Yeah.
don't automatically say medicine is bad. You know what? Sometimes medicine can be amazing and other
Yeah.
times not. If I
That's,
had the crystal ball, I could gaze into and say, this is
oh,
it. I will tell it. I wish, but no,
you would be the most popular neurologist in
I
all the world.
know, right?
That is so true. Well, just a couple more questions. I'm watching our time. We really want to wrap up right here at 9 and respect your time as well as our listeners. So a couple more, but you've spoken about, school and kids that have stress there. And, but what if a child is struggling in school because of headaches, like the headaches are affecting them at school? What can we be doing to support them?
Well, that's so hard because, school is their job, school is their life, school is their social life, school is everything when you're a kid. And if your headaches are so bad that they're affecting you in school, we got to do something about it. So one, I say, I got to do my job, which is I have to say, okay, what can I be doing to help with the headaches? Do you need an everyday medicine to prevent them? Do you need a medicine to take to stop the headache when it's starting? And those are things that we can do. Then we have to say, well, is there anything that's happening in the school that we can work with? I actually just today got a message from the father of one of my patients saying, hey, her headaches are being triggered when she has to go to the auditorium for school assemblies because everyone's so loud. Can you write her a note? Sure.
Yeah. Wow.
So
Okay.
if we know that you're going to get a headache because you're, in the auditorium or in the cafeteria with, 500
Thousand
rowdy,
people. Yeah.
kids, well, yeah, let's avoid that. So we can work out accommodations for the school to help us with to say, okay, let's let her, he always gets a headache when he goes outside for PE class, running around in the heat gives him a headache. Of course it gives him a headache. I mean, who wouldn't? Like,
Yeah.
okay, here's your note saying, don't do that.
That's great.
Or he gets a headache in school. What can we do? Well, we can make sure that, she can go to the nurse and maybe all she needs is 30 minutes in a dark, quiet room and to take her triptan to try to knock out that headache. And then maybe she can go back to class.
Yeah.
So we can come up with a migraine action plan
That's great.
to try to, one, prevent the headaches as much as we can, and two, handle them when they come up.
That's good. That's great. And I've got to think that like support from your doctor written like that to school has to support the child who, at school, they may be like, oh, you're fine. You'll be fine, but to have that written from a
They
doctor
need
has
it
to be helpful.
sometimes to say, no, this kid isn't faking it. They're not, overreacting. They have a bad headache. Come on.
Yeah. Yeah. Okay. One question from our audience. Is it unusual for a migraine to last several days, like 4 to 5 days?
I
Sounds
hate to say
awful.
usual. It's certainly not fun.
Yeah.
The majority of migraines in adults will last, 4 to 72 hours. Officially, kids 2 to 72 hours.
Okay.
Anything that lasts longer than that, we call status migrainosis, which means really long, annoying headache.
Okay.
At that point, you should be checking in with your doctor to say, hey, this headache hasn't quit yet. What can we do? And, we can try to do something if nothing else is working. And I always hate to say this. You can always come into the emergency room. The reason I hate to say it is because what do we want when we have a headache? Dark and quiet,
Dark
be left
room.
alone.
Yeah.
What do we get in the emergency room? Lights, noise, people. But they also have the medicine there and they got the good stuff. So
Yeah.
a lot of times with migraines, you get super dehydrated. They can give the fluids, they can give, IV medicine if you need it. So if you got a real bad headache and, nothing at home can crack it and you've spoken to your doctor, it's not wrong to go to the emergency room to try to break that headache. 4 or 5 days is a really long time to have a headache.
Yeah, it's awful. Oh, well, Dr. Kalika, this has been really encouraging, and you have given us some great information tonight. I know I have learned so much. I'm sure that our listeners have as well. And again, if there might be maybe kind of final word, but maybe there is a parent listening tonight that is, taking all this in, but still feeling like, I'm just afraid my child's headaches might be dangerous. At what point, would you say this would be the point where, that you should get some more information about this? You might should seek the help of a pediatrician neurologist when you be worried that they might be dangerous.
Okay. The red flags, so things that make me worry that a headache is dangerous, is when we have rapidly progressive headaches, when we have We would go from 0 to 60. We had no headaches at all. And all of a sudden, wow, we have headaches so often now. Things that make me worried if the headaches are associated with weird symptoms. What's weird? Oh, his eyes are crossing. He's dragging one side of his body. He can't walk when he has a headache. And again, these don't mean any, it's not, definite that there's something horrible going on. It just says, let's get that checked out.
Yeah.
Headaches that wake you up in the middle of the night with vomiting. Again, you can do that because you have the flu. You can do that because you have a migraine. And again, doing it once, I wouldn't, stress too much over that after you clean up all the vomit, of course. But we look at the pattern. You say, wow, he's waking up vomiting all the time. I'm like, yeah, check in with the pediatrician. And my answer to pretty much anything, if you're worried, talk to your pediatrician first. Your pediatrician is super smart. He or she deals with this day in and day out. And I tell everyone, the hard part of pediatrics is that most kids are fine most of the time. The pediatrician's job is to look at all these healthy kids and pick out that one kid. Wait, that one. There's something going on with that one that needs more investigation. So pediatricians are really good at it. I tell everyone I subspecialize because I'm like, nope, I can't think hard enough to be a general pediatrician where I have to know everything. I'm just going to do neurology where I can just focus on this.
That's great.
Always go and talk to the pediatrician, because if your pediatrician is worried, she will know what to do. And she'll say, nope, we need to go to the emergency room. Or, all right, no, I see why you're worried. Let's get this worked up. Let's send you over to the neurologist and she'll check you out some more. So the pediatrician can help you kind of stratify, what's an emergency, what's urgent, and let's just check this out and try a few things first.
Yeah, that's great. And your pediatrician has seen your child across the lifespan, hopefully.
What
So
it looks like.
you've got that good
You have
track
all
record.
that history.
Yeah, that's great. Dr. Kalika, thank you for your time. Before we close out, we're going to put a slide up here on the screen with some more information if you want to do additional research. We have some great links to resources here. And also want to draw to your attention and remind you, you can visit jacksonevents.org. You'll find great info there. But the new home for all the parental guidance resources is parentalguidance.org. And again, this one will be there. We'll give us a little bit of time. We'll get it up there on the website. You can send it to a friend. And there is a storehouse of resources there of previous episodes. Again, dozens. I think we're 30, 40 episodes now. So go back there, check it out. You'll definitely find something that you can learn more about. And please mark your calendars for next month. Again, the third Thursday. In February, it's going to be Raising Healthy Eaters. So intuitive eating for kids. We're going to have a nutritionist join us and talking about developing a healthy relationship with food and with your body. It begins in childhood. So we're going to learn about picky eating, what foods provide nutrients that your child needs. And most importantly, we're going to look at ways that you can learn to speak to your child about foods so that you can impart a positive relationship between food and body. So that's going to be a great episode happening in February. And again, just parentalguidance.org if you want to check out any of our previous resources and to stay connected with what we have coming for you. So again, Dr. Kalika, thank you so much for your time and your expertise tonight.
It's my pleasure. Thank you so much for inviting me.
We appreciate you. And thank you all for joining us.